Hi, I'm Mike Troop. I just approximately about 3 months out on my knee operation,
Right total knee.
right total knee operation. Everything's going really good. I'm pain free. Uh, everything so far the doc said was going to happen is happening. I mean, I still got a little numbness, but that's from the other procedure I had done, but everything is feeling good.
How's from the last time I saw you to this time? How's your like walking with stairs? I know you were fishing at a month out. Like,
Yes.
how's stairs
Walking
going?
upstairs, up and down stairs, I don't have no problem whatsoever. I just gotta watch real quick moves going down because I'm used to doing stuff like that, but everything else is going smooth. I mean, it's nothing compared to the way it was before I had the operation.
So you happy you stayed here at Penn Highlands with us?
Penn Island has treated me really well.
Okay. And just and this will be the extra part too, is pretend you're talking to one of the patients who does chewing tobacco or smokes, or we'll stick with chewing tobacco, and talk us through your experience of stopping for the 4 weeks beforehand and how that went for you.
Well, I've been a chewer ever since I, believe it or not, 12 years old, so that's nearly 50 years. And I found out I had to quit chewing because the nicotine is very hard on the healing process. So I gave up chewing snuff. I went to nicotine kind of stuff you buy at Sheets, and
The nicotine-free ones.
nicotine free and tobacco free.
Yeah. And tobacco-free, yep.
And it worked very well for me. It held me over for 4, almost 5 weeks, and I did break down after that, but when I started healing, and I did get my regular snuff. But there are substitutes out there that will get you
So
get you by if you are a serious snuff chewer.
So if you got serious snuff chewers, this guy started when he was 12 years old and he was able to do it.
Yes.
So you think that anybody else out there can do it?
I figure if I can do it, they can do it.
There you go. All right, love it.